Okay. So, as many of you know, and many of you will have seen, we produced a report in late August, or sorry, I should say late September, in line with the 1st of October Older Persons Day, to think about and to depict and reveal how the funding of elder care in South Africa is, how it looks, what does it do, and what does it not do. And we did this together with partners across the country, particularly TAFTA and NOAA in the Western Cape. And really how this came about it was the beginning of our program, the Family Caregiving of Older Persons in Southern Africa program. And basically in late March, early April, Gabby Kelly and I were engaging with a range of stakeholders, mainly nonprofit organizations that work with older persons. And we were meeting various organizations to introduce ourselves, introduce the program, see what possible collaborations could take place, etc. And one of the meetings we had was with a particular organization, and it was I think it was early April. And we went there to introduce ourselves and talk about, the programs and possible collaborations. The meeting involved and exclusively looked at the financing that they had just received the letter from the Western Cape of their budget for that coming year. And literally they had just received the day before. And so the director of that particular organization literally couldn't think of anything else. What was shocking to that particular director and for their organization is that they were currently unable to finance their programs, the social workers that they offered in terms of their programs. And this particular letter and the subsidies that got outlined in that letter was going to be a cut on what they already had. And so whilst the previous years they had been dealing with austerity, post-COVID kind of changes to budgets, this was a further knock in terms of how they understood that, what was going to happen in the coming year. And so we left that meeting, Gabby and I, we both realized that, first of all, it's not entirely clear to either of us how the entire landscape of funding elder care actually happens. Who gets what, for what, how, who are all the players involved? How much autonomy or decision-making do they have over what they get and how they spend it, etc., etc. How much of it's dictated or, decided upon by national, provincial levels, and what does that actually mean? So following the meeting, we realized we needed to map this out. We literally got, A1 chart, started with literally a pencil in our room going, who are all the players, and needless to say, it started there, but it took several months to unpack the various parts to it. So what we did is we decided we needed to look back in time too, because we knew that if we only looked at the last couple of years, we knew COVID and the story around COVID and the changing budget was going to dominate the narrative of what actually is happening currently or in the last couple of years. So we went back in time. We started in 2006, 2007 with the introduction of the Older Persons Act. And the introduction of the Older Persons Act gave a framework for stating that the state wanted to focus and prioritize aging in place, a concept we've all heard of, and is often difficult to actually measure or get to grips with about what exactly does that mean and how well is it actually supported, i.e. older persons remaining at home or in the community for as long as possible. So what we did is we analysed the national older persons programming and budgets in national, provincial annual reports, annual performance plans, the estimates of provincial revenue, expenditure, budget statements. There's a whole base of a range of reports. And we did this for about 4 or 5 months in reviewing this. And we did this from the period of 2006-07, when it's kind of, obviously the act was introduced, up to the current day, so into 2023. We also, needless to say, crucially relied on information and the experience of our partners, NPOs who had been receiving these subsidies and managing this funding landscape for many years. So it wasn't new to NPOs, but we also had to put these pieces of the jigsaw together. And as I said, Famada will speak to this now in time of how it has been experienced from a different perspective. So what we did is we produced the report and we launched this on the 1st of October. But this report was also supplemented and should be read alongside a report on the experiences of community care, which is based on a series of meetings of older persons fora that we held in the 6 sites that we are in South Africa with our partners. So obviously in different parts of Western Cape, in different parts of KZN. And so the 2 reports need to be read alongside each other, because the funding report gives details on numbers, rand spent, on what, by whom. But the community-based care report gives a real sense of what that means and how it's experienced on the ground by all players involved in care of older persons: home-based carers, community healthcare workers, family caregivers, NPOs themselves, and their organizations. And so that's where the 2 reports kind of work together. So saying that, sorry. So when I was talking about how Gabby and I kind of understood this, what was going on, not just us, I think it was much of the team, to be honest. We came up with this infographic, right? And this infographic tries to map out, so this is what we had on our A1 sheet at one point. Up here, we have government funding of older persons care South Africa, right? And we are not ignorant of the fact that many departments try and serve older persons. It's not just Department of Social Development, right? So Social Development and Department of Social Development is on this side of the infographic. On this side of the infographic, we have Department of Human Settlements, i.e. housing largely, and Department of Health, who are crucial players, needless to say, in broader care for older persons in communities, as well as obviously in hospital settings. So this infographic was set up in a way of who's involved, what do they do, and what are the costs of what they do? How much funding do they have, and where does that go? Now, the thing is, DSD is mandated to implement the Act. And as I said, there are other departments, providing services. Unfortunately, it's very difficult. The breakdown of these services, we had several meetings with colleagues of the Department of Human Settlements. They weren't able to tell us how older persons are prioritized in their programs. Believe you me, we had many meetings, and we definitely reports being sent back and forth, and we tried to get our head around it as outsiders. They were trying to assist, and it wasn't going anywhere because they don't have older persons as a category as such, where funding is allocated, programs are specifically designed. They're caught in the mix, needless to say, similarly with the Department of Health, although the Department of Health is a little bit different in some respects. So that was an important thing, that we couldn't really tangibly get our exact figures. This is a work in progress. We do want to get there over the 5 years. We do want to ascertain those numbers throughout our program, because we don't believe it's just Department of Social Development, obviously. It's really important to acknowledge that the Department of Health has a particularly important role to play in long-term care for older persons. They provide free primary health care to older South Africans, also covers the cost of secondary and tertiary care for persons. And as indicated in the diagram, they also have responsibility in providing some home-based care services. This is where it gets very patchy. If you're on the ground in any particular community, understanding who's responsible for this group of home-based carers. Is it HIV, TB, programs? Is it this? Is it that? And it's a mix most of the time. But as I said, Department of Health really do play a central role in not only the primary health care facilities, but residential care facilities, and making some provision for medication at residential homes and service centres, provision of some incontinence products, for example, at clinics, etc., etc. So we're not overlooking that work. The problem is we couldn't actually get the data and the figures, at that point in time. So our calculations don't put a precise amount as overall state spending across these different state departments, but it demonstrates what the Department of Social Development is doing. Okay, so here we then show how within the Department of Social Development, it breaks down into the national budget, where social grants are managed and controlled and implemented. And that's the vast majority of spending. I'll come to that now. So, but it also breaks into the provincial level. So where allocations to NPOs who provide on-the-ground support through service centres and other needs, residential homes, for example, that is organised at a provincial level, and it has a separate budget a province manages, which will compete, needless to say, at the provincial level with education needs, with health needs, with all other kind of competing concerns. But as you can see, the amounts, if you can read it, are for social grants at a national level, are the vast dominant form of support that comes, let's call it, from the South African state, and it comes in 2 ways. It's the older person's grant, which is currently at 2,080 rand and serves 3.8 billion people, and the grant in age, a much smaller grant both in size but actually in prevalence. it also, some of the funding also goes to running programs. So the DST themselves have the South African Older Persons Forum, and that has been growing. So this is how we mapped it out, basically. Now, the key findings from this report were that whilst the economic value of support has grown, it's not necessarily being increased sufficiently to meet the needs of a growing older population, nor has it been adequately linked to inflation. So state spending is not most importantly, it's not prioritizing community care, despite the legislation and policies all pointing at aging in place, community care, supporting families, to care for older persons. And that's the largest contradiction in terms of funding allocation. Now, one could argue that social grants is that form of support, and that's why we're thinking through what social grants actually do at a household level. So in a nutshell, in 2022-2023, the total DS budget spent for older persons was just over 95 billion. And that had radically, I'll show it to you now just shortly, had radically increased since 2007. Not only because the number of people who are eligible to receive largely an older person's grant, but is obviously massively increased. I'll show you the numbers shortly, but also the eligibility criteria of who gets what when changed, and that had a huge impact on the numbers of people receiving older persons grants. Now, as this report outlines, despite the focus and the prioritization of aging in place, very little funding is allocated to organizations. So if we look at this diagram, 1.6 billion goes to provincial level across the provinces, needless to say. And that's really looking towards supporting residential care homes and what are called service centres, largely speaking. So community-based care. And that, in a nutshell, serves about, on the whole, almost 100,000 older persons. So the 78,000 and a half, roughly 78,000 older persons accessing community-based care. There's 18,000 roughly people served by residential care homes. So it's a very small number. It's a tiny number. On the other hand, older persons grant, there's 3.8 million people receiving it. So you can see where the funding is going, where and it's supporting the vast majority of people. The grant and aid, the spending on that in that year was 121 million. It's a very small sum. And you'll see later how we are making the argument that it isn't necessarily being reached in the way it should. And I'll explain why. With 252,000 recipients, who are the older person grant receivers themselves, who require full-time care. That's what that grant and aid is for. So next slide, please. Sorry. So we basically, and I know these numbers might be a bit small for you to see, but obviously you can download the report and read it in detail. What we saw is the spending. So we're not saying that the Department of Social Development is, in any way negligent in serving older persons, particularly in social grants. They have been increasing over time because the number of people needing the grant has been increasing, and they changed the eligibility for that men would also get the grant when they were 60 and not 65. Previously, there was a discrimination. Women got it at 60, but men didn't. And that obviously brought more people into the mix. The numbers of people receiving the grant over time has also, I won't say doubled, but it is close to doubling at some point soon. And the money and investment into older persons policy and development, that's, as I said, there's mainly the South African Older Persons Forum. Not only that, it's also the staff, the people working in the Department of Social Development. That also has, was it radically increased, but maybe it's fourfold what it used to be. Then needless to say, these, what you can see there is that the national spend is increasing, but the provincial spending is not increasing in the same way. There was actually a 13% decrease when the real spending was taken into both inflation and the number of older persons, the population actually growing. And that's one of the main findings from the report. And actually putting a figure on that and showing what it is an important conversation, to a point of conversation with the Department of Social Development. We want to work with them. This isn't something to critique them on. We want to see how this can be better organized and structured. Next slide, please. Sorry. One of the important points coming out of this, needless to say, was the vast disparity of which provinces get what, and the spending in different provinces across the country. Now, there's, needless to say, historical reasons for this, and I can explain, what's going on here. In a nutshell, you can really see that the distribution of older persons by province, is that places like Gauteng, which has a huge older person population, at places like KZN, which also has a huge older person population. It's not necessarily the number of older persons that's important. It's the number of older person grant beneficiaries that's important. Because somewhere like Gauteng does have the biggest population, but not all of them have the same needs, both financially and otherwise, to access services and etc. But what you can see here is if you compare the Western Cape with KZN, the spending on both of them is highly uneven. So, for example, the Western Cape received significantly more at 260 million compared to KZN, who received 181 million, despite KZN having far more older person and particularly older person grant beneficiaries. So this kind of analysis sets up, it's not just about the amounts and who are they serving, but it also then plays into what happens on the ground. If there's not as many service centres, or if the service centres are not as serving as many people, what does that mean to families? What do they have to do? If you're trying to secure food in your house, if there is a service centre nearby, you can go there 3 times a week, twice a week, 5 times a week, and get a plate of food for 15 rand that is very nutritious and wholesome, and can serve maybe feed 2 or 3. That's what people are doing on the ground. They're managing these supports that are offered at a community level with what they can do in their own families and their own households. And so that's why these figures are really important when we think of how does it impact a family in a particular household. So whilst we see huge disparities, some of the disparities can be explained by the fact that somewhere like the Western Cape has far more residential homes than anywhere else. If you look at it here, the care homes, there's 125 care homes in the Western Cape, compared to somewhere like KZN that has 37 care homes. Therefore, those care homes need to be supported. They need to be funded. And care homes, as we know, are very expensive. So therefore, they're allocated more money. So there's those historical, reasons for the existence of large number of care homes that shapes what happens on the ground. Okay, so from here, we're going to move into 2 case studies. Famada is going to speak about the case study in KZN, but just to say that NOAA, who are our partner here in the Western Cape, the neighborhood of older age homes, they worked with us in providing the figures of what they need to do in order to supplement the subsidies that they receive from the Department of Social Development. What I mean by that is what is their shortfall and how do they manage? So in each of our case studies in the report, we outline what does the province offer in terms of subsidies, and it's not the same across provinces. So the Western Cape here is a table of what they offer. And in KZN, we also have another table. And if you look across them, they're different amounts for a range of different reasons. Some offer will also fund certain services and others won't. And I know Famada will talk about that in detail now. So just to, Veda, next slide, sorry. So just to show that, for example, NOAA, who run, and I should mention at this point, the 2 case studies that are highlighted in the report are coming from NPOs that have vast amounts of experience, are much larger than the vast majority of NPOs that operate on the ground, provide a range of services that the normal NPO on the ground, I mean, there's no such thing as a normal NPO, but that they can't offer, they can't afford to run. So they are highly equipped and still have a range and intricate mechanisms and organizations that provide extensive services to older persons. So those 2 examples do need to be read. We did reach out to obviously smaller organizations. We are working with smaller organizations. Needless to say, smaller organizations don't have the time or the wherewithal or necessarily have the numbers to be able to say, oh, this is the shortfall on this year. They just don't have the time to get those numbers. So that's, that needs more work, basically. But just to say, you can see the deficit for this particular NPO, NOAA, in the Western Cape, was basically half. They were being supplied X amount. The cost was, I say, for housing, because they do supply housing, was 840,000 roughly rand, and the deficit was 400,000 rand. And you can see as the service centres, similar thing, either the service centre in Kailicha or Woodstock, and their health programme too. So they had to self-fund that 50%. I'm going to hand over to Famada. Famada, if you can come up here, to hear more about KZN.
must say it's been a very interesting journey going through this process with Alina and the team. And I think also just to get an idea of the vast differences in terms of funding from the different provinces has been quite a learning curve for us. Okay, so from TAFTA's perspective, maybe just quickly, in terms of TAFTA, we are the Association for the Aged. We're a non-profit organization that was established 65 years ago by a group of volunteers who thought it was a good idea to take care of older people. And over the years, we've sort of transformed our services to meet the needs based on what the current context is. So we currently support about 5,500 older people, 1,900 people under roof, and the rest of them in the community via our service centers. And I think over the years, we've changed our basket of services based on what the needs are, what is relevant in terms of the context as well. We're a predominantly Durban-based organization, so our context is urban poverty amongst older people, and we've worked in the peri-urban areas as well, in particular, one of the sort of township areas, Amahoti in Durban as well. Okay, so in terms of the report, we looked at funding that's available from the Department of Social Development. It comes in three forms. One is you get funding for frail care, and that is per capita funding based on, go back, yeah. So based on the number of older people in your care home. But just to also clarify that there's an entire formula that they use in terms of funding. So for example, in one of our facilities where we have the capacity of 33 beds, we get funding for 12 beds. So they don't fund all the older people in that particular facility. They will register you for a number of beds, and that's what you get funded for. So that's the first kind of mechanism that they use to try and sift out those who are most neediest in terms of the Department of Social Development. The second thing they look at then is the means test. So an older person on just getting an old age grant would qualify for the full subsidy amount, but there is a sliding scale. So if an older person may have worked and receives, for example, a Transnet pension, then you'll find that the amount that you get from the department is far lower. So in effect, what the policy does is that it punishes people who have saved a little bit for their funding. We call it sort of like the gray area, where it's better for someone to have no other funding except the old age grant. Because as soon as you get a little bit more money, you can't access any kind of government funding, which is quite a stupid situation we find ourselves in, but be that as it may. So not all the older people in a facility will get funded. You have to be registered, and over the past couple of years, we've seen the number of beds that subsidized decreasing, and I think that's what Alina's been talking about. So whereas when I started off at TAFTA, we had over 300 frail care beds, we now have 100 frail care beds. Of those 100 frail care beds, we have just under 60 that are subsidized. So you're seeing a substantial decrease in the number of beds that are available from the Department of Social Development. The funding that comes through, though, doesn't cover the full cost of care. So you'll see on the first line where we talk about in 2015, the shortfall that TAFTA had to find for each older person was 3,800 Rand. So when you have 100 older people, and you have to multiply that 3,800 times 100, that's your monthly cost that you have to try and fundraise for. But you see the situation has now gotten worse, where we now have an increased shortfall of 6,600 per older person. So your total cost of care is much higher. As such, from an organizational point of view, what we found is when we did our strategic planning at TAFTA, we have flagged frail care in terms of institutional care as a service that is not affordable, and not accessible in terms of our older people. So that becomes quite a critical issue on our side, because as much as we're a nonprofit organization that's serving the community, we also run a business. And so our board is saying to us, if you have a service where it's not affordable because we cannot fund this continuously, and it's not accessible because the numbers are not substantial enough for you to say you're making an impact, you need to start thinking about other models of care. So our solution was to look at home-based care, and I'll come back to that just now. But let's talk about assisted living for a little bit, because I was very interested when I saw the slide. In terms of the Department of Social Development and engagement with TAFTA in particular, they stopped funding us for assisted living in 1995. They stopped assisted living. So I'm surprised to see that there are still some facilities that are being funded. And also your comment about how they are under their targets in terms of what they should be funding. But the conversations with the department staff is around this whole notion that we don't fund assisted living units. But I'll talk quickly about some of the things that happened last week, and it seems like they probably will start looking at this again. But in terms of assisted living, this is where the person is not quite frail, not quite fit, you're in between care. And the cost of that in terms of TAFTA was that in 2015, we had a shortfall of 2,950 to provide that service. Remember, this is now self-funded. The older person will contribute a portion of the old age grants towards their care, because it would be board and lodging, so it's cost of accommodation and meals. And then in 2023, we see the cost of care now at 2,500. So the question then becomes, how is it that you've reduced the shortfall amount? And that's really very creative accounting and trying to look at economies of scale. But at TAFTA, what we did was we actually looked at cross-subsidizing. So we'll have fit accommodation, frail accommodation, and assisted living. And we look at then cross-subsidizing the services. So it really is about a cross-subsidization model that's enabled us to bring down the costs, because when you have more people, you can then capitalize on economies of scale. And you know, that's kind of what we had to do in order to continue to provide the service. The next aspect or the next level of funding comes in from your service centers, and most of the community-based services are funded through your service centers. And here we get the handsome sum of, at the moment, it's 17 Rand 85 per person per attending member. In 2015, it was 16 Rand per person per day. But here again, it's capped to a certain level. So for example, where we had the dialogues at Primrose Service Center, that particular service center had a membership, I think in 2015, of over 300 members. We were subsidized only for 105 members. So it's your 105 members that come through. But the formula in terms of funding was it had to be your top attending members. So if someone doesn't come in every day, you cannot capitalize on that funding amount. So I will have Mrs. X who comes in maybe 3 times a week. So your funding is only for that attendance. So it's not a globular figure in terms of what they have budgeted for. So in all the years I've been at TAFTA, 24 years, we've never been able to maximize on the sub-center subsidy, because older people cannot afford to come to the center every single day. So again, some maybe creative accounting and creative ways of accessing the funding. We then said, okay, instead of the older people coming to the center, what if we took services to the community? So the Department of Social Development will fund you for attendance figures and for visits. So we then started expanding our home-based care program into the community. So at the moment, there's 85 older people who should be in frail care, but who are receiving services in the community. And we are able to access this 17 Rand 85 per person per day for these people. But just in terms of the cost of care, in 2015, when we costed out the services that are rolled out through the service centers, we were sitting with a shortfall of 64 Rand per person per day. Where did that cost come from? In terms of the documents that we sign with the Department of Social Development, we sign a service level agreement, and they say to us, for the 16 Rand per person per day, you must deliver on 14 deliverables. So there's 14 things you must do. And the 14 things includes meals, transport, medication, awareness programs, list of things. So we costed out, what does this, how much is it going to cost us to provide this? And at that point, it was 64 Rand. Now you'll see for 2023, the shortfall is now 35 Rand per person per day. And you may ask yourself, how is it that it's now substantially lower? That is the impact of COVID. So when we were looking at the numbers, when COVID hit, we had to close down the service centers, because remember, the government policy was that no services will be rendered out into the community. But TAFTA took a decision to continue with the essential services of meals and home-based care. So those were the two essential ones we continued with. All the others, the other 10 deliverables, we didn't deliver on. So when we're doing the costings, it's not taking into account all the other programs that needed to be, delivered on. So yeah, it becomes quite a complicated story when you're trying to understand the funding from the Department of Social Development. At this point, can I just maybe talk about the changes? So there are different ways in which the different provinces pay out the funding. And at the moment, in KZN, we're having quite an issue, and this is so not in my modus operandi to fight with the Department of Social Development in this manner. But they've moved from an arrear-based system to paying in advance, which in theory is absolutely wonderful. So previously what would happen is that you would provide the service, you submit your claim, and you get paid. Albeit you get paid 2 months after you've provided the service. They've now said that we will now pay you in advance, in quarterly payments in advance. And we thought, wow, wonderful. That's how it should be. However, they've now rolled out the quarterly payments. We are sitting in the last month of Q1 as per their rollout system. And many organizations in KwaZulu-Natal have not yet been paid in terms of this advanced payment system. So that's been part of the issue that we've had. So they've moved now to a new payment system. In theory, it's beautiful. In practice, it doesn't work because they have not worked out the enablers within the department. For example, the Department of Treasury has cash blocks. So as soon as you're making a payment of over 1 million, it blocks out that payment. So when you're doing a 3-month advance payment, it's going to go over that. So that system doesn't enable that kind of payment. And we find a whole lot of NPOs have had to realign their work. And now this is the reality of the situation. And one of the things that sparked us to actually approach media and look at a legal recourse mechanism. Many of the organizations could not even afford to buy food for their residents. I mean, one of my co-workers had come to work the one day and she had a bag of food. And I'm like, what is that for? She said, no, this is for one of the homes because they've got no food, because they've got no money. And many organizations are not in the position where they have reserves. They've used up all of the reserves. The other situation they found themselves in is many of their staff couldn't come to work. So one of the organizations that I was speaking to had arranged for their vehicle to pick up some of the staff members at the bus stops. But that now increased their petrol costs. So now they have this other situation because you know, from a staffing perspective, many of the staff members, so when we talk about impact on families, many of the people working in the nonprofit organizations have families that they need to support. They were not able to pay for all of their bills. So you had an issue around debit orders being rejected, not being able to pay for basic things. And then you had the unions involved. So certainly now nonprofit organizations were having to deal with these issues. So the situation becomes quite critical in KwaZulu-Natal because of the change in the system. And I think more especially it's the non-engagement from the department. The only time the Department of Social Development talks to us is if something goes in the media, then we'll sit down at a table and have a discussion. But yeah, it's interesting times in terms of where we're at. Right, should I go to the next one? Oh, it's not, yeah, there you go. Yeah, I think these are just some of the figures in terms of the residential facilities. You'll see that the number is not substantial when you look at people within our old age homes, as they call them, our residential facilities, 2,500. When you look at it within the context of the rest of the country, there are 37 homes. When I started at TAFTA, I think we had over 60 homes in KwaZulu-Natal. So you're seeing more and more of the homes are closing down because frail care is just not affordable. Many nonprofit organizations cannot afford to support the service. Just to give you an idea of what the costing looks like, and I'll share with you guys. So TAFTA's operating budget is about 90 million a year. 10 million is for our 100 beds in frail care. So that just gives you an idea of how much of money. So we've got 5,500 beneficiaries, 100 beneficiaries utilize 10 million. So that's how expensive frail care is. And part of the reason that it's so expensive is because of the norms and standards in terms of our Older Persons Act. So we have a first world system in terms of norms and standards with lower to middle income situation in terms of delivery of service. And that's kind of the discrepancy that we're having to deal with as well. So, and then I think we spoke about some of the others. In terms of protection services, yeah, it's particularly with regards to the number of abuse matters that are reported. And we're seeing there's been a situation where these matters have been underreported historically. TAFTA launched a national helpline in November, and we're starting to see more of these numbers now coming through. Previous to that, there was a national helpline. And again, because of the funding issue, the Halt Elder Abuse Line HEAL, which was Western Cape based, closed down, I think in 2018, if I'm not mistaken. But it left a huge gap because people then don't have any kind of recourse mechanism. And we're starting to see more and more numbers coming through in terms of the helpline. We have about just over 5,500 people accessing the community-based services. And here it is mainly in KwaZulu-Natal, it's mainly on luncheon clubs. So meals are a big issue in terms of the centers and what's being rolled out from there as well. Okay,